Public Health England has launched its latest Better Health campaign to encourage adults across the nation to lose excess weight, eat more healthily, and get active this summer. The new campaign offers free evidence-based support and guidance to those working towards a healthier weight. We speak to Douglas Twinfor, registered dietitian and nutritionist, to learn more.
Why is it important for people of African descent to maintain a healthy weight? We know that people of African descent are at an increased risk of certain health conditions, such as type 2 diabetes, high blood pressure, and stroke. Although there are different factors that conspire to increase our risk, we know that our weight plays a major role in this. So taking steps to lose any extra weight that you may have gained during the pandemic is key to reducing your risk of these health conditions. Am I encouraging people to go on a diet? No, strict diet is not the answer. Making simple changes to the way we cook and serve our traditional meals can make a huge difference to our health and reduce the risk of these health conditions. Is it realistic that people would change their traditional meals that have been passed on from generation to generation and start eating differently? My answer would be no. What we are trying to encourage people to do is to make simple changes to the way they cook and the way they serve their foods. For example, we are encouraging people to reduce the amount of salt they use. So by using things like spices and herbs, you can get the flavor from your traditional meals without using too much salt. We are also encouraging people to choose healthier versions of oils. So for example, you can choose a vegetable oil instead of palm oil. And then when you are using oil, to use less. By doing these small things, you can improve your health whilst enjoying your traditional meals. My first tip to people is that our traditional meals are usually healthy. But what happens is that we tend sometimes to eat a bit more than we need. So my first tip would be for people to reduce their portion sizes. You can do this by using smaller plates and bowls, and also saying no to second helpings. My second tip would be to encourage people to eat more fruits and vegetables. You can have it as frozen or fresh. We all know that we have been asked to include at least 5 portions of fruits and vegetables daily. And you can use these in your stews and soups, which will give you all the goodness you need in your diet. My third tip will be around carbohydrates, because as a community, carbohydrate foods form a major part of what we eat. So I will encourage people to choose healthier versions of carbohydrate foods. So for example, instead of white rice, I will encourage people to choose brown rice, but also include more of our foods that are higher in fiber, such as our plantain, sweet potatoes, and green bananas.
As part of the campaign, Janet and Paul from London have shared their experience of weight gain during the pandemic and how they are determined to adopt healthier habits by adapting their favorite recipes.
Janet and Paul, thank you for welcoming me in.
You're welcome.
So what are you going to be cooking today?
We're going to be cooking beans and plantain. In Nigeria, it's called a Oloyin ati dodo.
Why are you making changes to this recipe?
We also gain weight during the lockdown. We are all stuck in the house together. The tendency to be eating late at night in larger proportion, more than the normal. And we all know that this is not healthy at all.
What are you changing to make this traditional dish a healthy alternative?
We are going to be reducing the amount of oil that we put in the beans and also reducing the amount of salt that we put in the beans.
And the last thing is that we're going to cook our plantain without oil at all.
Why is cooking so important to you?
Ever since lockdown, Paul has been more involved.
We cook together, we eat together. It brings great bond within the family.
And the children have got to learn more about cooking the African dishes.
It keeps the tradition going.
Keep the tradition going, and it has strengthened the relationship.
And the love.
Yeah.
The dish looks great, it smells delicious, and I look forward to making it myself when I get home.
Thank you.
Thank you very much, and we do hope you enjoy it.
So how can people learn more about the Better Health campaign? My suggestion would be to search for Better Health or visit the nhs.uk/Better Health website. The website will be scrolling on your screens now. On the website are tools and resources to support you to make healthier changes. We have new recipes and traditional recipes that have been adapted to make them healthier, such as Ewa, Oloyin, or Oat Fufu. So you can prepare your own traditional meals, but in a healthier way. And all these recipes will be available on the NHS Easy Meal app. Thank you.